You welcome and give it to Surendra sir.
Okay, sir.
Okay.
Good evening, everybody, and welcome all to our evening's program. Our Surendra sir will take the session forward. Please, Surendra sir, please take the session.
Thank you, Mr.
Yeah.
Welcome you enlightenment homeopaths. Enlightened homeopaths. You all know the basics as well as how to proceed and how to treat all problems without going to the deceased. You also become deceased.
What is not a mic off, sir?
Some reflects.
Yeah. What is the mic? Okay, got it.
Yes. We have been discussing about the dosha in homeopathy. Of course, I told you about the nature of fire, air and water, how they balance the body. Of course, before going to that, let me give a short brief things about common health problem. Why? Because too much of medication is always cumbersome disturbance. Even in homeopathy, you cannot take more medicine. That is, honeymoon is not recommended combination. But modern days somehow require, not in all the areas, but only in some areas. That is why we have to make balance of the harmony of the body, the essential and good health well-being. In other words, you must keep yourself harmonious so that the vital force will help you to ensure the good health. There are natural remedies which are available in nature for us to overcome short and simple things. Sir, I know all these things, sir. It is not helping me, sir. Yes. How that has come? How the chronic thing has come? Because they have allowed without taking it out or plucking out the nip of the bud in the beginning. So every season, when you are suffering cold, when you are suffering pain, you ignore. Or you take some medicines, paracetamol tablets, something like that. They say some, yes, some inhaler to the nose, clear. Is it workable? It's only temporary. So what do we need is only that, for example, clairvoyance. If you want to have a good health, some things must be there. Cold and food remedies. You know, warm tea with honey, lemon and ginger can provide you good health, relieving from cold and food. So this was featured in the TV broadcast. They added this to the tea powder and they have been advertising this. Yes, that's what I'm telling. Because you are not taking it, It is being given in the form of tea powder so that at least it is nurturing your tea and your health is being improved. Honey is meant for antibacterial quality. It can soothe on the throat, relieve congestion. You can take honey in the warm water and sip it slowly so that the warm water gives a soothing effect in the throat and relieves the cold and flu. Because bacteria are sitting there, it can soothe and push it to the stomach and then it will come out. Boil water with freshly freshly cut ginger and squeeze some lemon juice. It can also help you in cold and flu. You can take all the three into one ingredient or take them separately also, it will help. This powerful combination not only makes you relieve, but also gives you a improves your system. All right now this is except that ginger is very antibacterial. It improves the body system. Yes. This is the cold and flu. Stomach upset. Digestion is the problem for day-to-day problems like us, because we don't want to change our food habits even after crossing 60 or 70. We cannot take very salted or very hot foods, very strong food. That may give disturbance to the stomach. So herbal tea gives you relief to the gastric problem or bloating stomach. Generally, the mint leaves, you know, pudina in Sanskrit. It is used generally in all the problems of stomach upset. They are coming in the form of tablets in the herbal stores. They put this pudina tablets or peppermint tea after meal. There are variety of mint leaves, spearmint, peppermint, etc. These things will balance the three doshas of Vata, Pitta, Kapha. Pitta dosha, etc. Another good remedy, apple cider vinegar. It can be taken in warm water before meal. So it reduces the acid levels in the stomach and helps you to proper digestion, and you don't feel inconvenience of your diet. Ripe banana helps you to gentle and ease the digestive problems. Plain rice, consume plain rice, that is cooked one, or bread toast, can help you to absorb the stomach acids and provide you relief. That is why during stomach upset, you take only plain rice with diluted pinch of salt is added. Or you can take brick toast. Then skin care. Coconut oil is the best remedy for all problems of the skin troubles. It's a good moisturizer, nourishes the skin, keeps it soft and supple. Then tree oil is an antibacterial property that can reduce inflammation, clear the acne. So this is also one thing. Small amount of tea tree oil can apply to the places where acne is there. Sir, homeopathy, you have been advising us when skin problem comes, then that means morbid things from inside to outside, so it is exhibiting outside. While applying this oil, tea oil, can you mean to say the health is restored? No, we have to take internal medicine too. Internal medicine too. We are all well equipped with skin problems and medicines that are coming to that, and can care ourselves by yourself to all the skin problems. Stress and anxiety. What is stress and anxiety? Lavender oil is a diffuser, inhaling directly from the bottle. It can lower the stress. Lavender is considered to be causing calmness, cooling and soothing effect of the mind. So stress and anxiety is gone. Ayurvedic teachings, lavender oil is particularly useful in enhancing the prana or vital force. So, every symptom, they will try to help relieve you, try to help the rejuvenation of the vital force, except in other allopathy system. So, the idea of treatment is always try to strengthen, make the vital force normal so that it will come up and fight any problem, disease, skin problem, or any flu, fever, pain, etc. Chamomala is one of the one that also gives you some calmness. Chamomala tea is preferred. We got chamomala in the homeopathy as a medicine. It is, in Hindi it is called babuna. Then comes insomnia, sleeplessness, physical and mental health disturbances, causes sleeplessness. Valeriana tea roots, Valeriana root tea is help in inducing the sleep. We have got alumina, we have got belladonna, and another thing, it is insomnia can be greatly relieved or reduced by teaspoon of honey mixed with and taking it in the night. Then nausea. Sometimes eating plain crackers, consuming ginger in a suitable form like ginger candies, ginger tea can help alleviate nausea. That is why all our families, Hindu families, they keep the ginger tablets ready. Whenever there is a nausea or difficulty in the digestion, they take that, put it in the tongue. They don't chew, they just put it in the tongue or side the mouth. So slowly the ginger essence goes into the stomach, relieves the problem. Sipping of lemon infused with water on regular basis is also relieves nausea. Or one more indication, most of us take the ginger tea. Then coconut sesame oil in the mouth in the morning, that is, you take 1 or 2 teaspoons of coconut oil or sesame oil, not all, not both, in the one. Then for 10 to 15 minutes, you gargle your mouth. This is a very good medicine for all of us, all of us. If you gargle your mouth, all the bacteria will be thrown out, and as well as the essence that goes into the stomach gives you very, very great relief in digestion and the other problems. In addition, it will induce the process of digestion, assimilation, absorption, etc. Muscle pain. You soak the muscles in the warm water, warm bath, or some Epsom salt can be added and it can be applied on the muscles where pain is there. Or paste of turmeric and water on some sore muscles will give you relief.
వాడు ఏదో చేస్తే ఎప్పుడు అలాగే
Allergic
ఇక్కడ
bronchitis,
కూర్చుంటే వస్తుంది.
any form of pollen grapes, etc. Patients with small doses of local pollen by consuming natural honey. So, you go to some different place, some atmosphere, pollen grapes into there, and that will cause you some upset, nausea, giddiness. There, you can take honey and gargle it or swallow it with some warm water. So, these are the very main medicines that you must store in the house. Always you must have it. So that you will be rid of all the sudden, not only that, it will improve your immunity, it will strengthen your vital force,
రోజుకి 2
thereby onset of disease is very, very remote. So with like internet. Okay. Time is over. I take up the of 2 other important things like classes of diseases, because you see this Sitosa in homeopathy explains. You know the body conditions, you know what is the excessiveness or deficiency, because disease is called deficiency. Deficiency causes disease. So thereby, you understand the condition of the disease. So it is for the physician to know that. Why should I know? No, everybody must be a local doctor. Doctor in the home. Everybody can't be assigned to the physician. So I take the classes of diseases, then I go to the important element of diseases. So this is important for you to understand what is the problem that you are facing, what is the weapon you are possessing, and how to tackle it. Okay, thank you. Over to Anu.
Thank you, thank you. So today we are discussing urinary tract infections. I think all can view the screen. Urinary tract infection is a common what we all know. Passing urine, bring down, burning sensation, all those things mostly experienced by babies. Women, even though men can also get this infection. Let's see how it is. So, as mentioned, urinary tract infection is a bacterial infection that affects the urinary system, causing discomfort, pain and potentially serious complications if left untreated. If you just think that it is just urinary tract infection and leave it like that, it can lead up into bad complications, infections to the kidneys and other vital organs can happen and can be very difficult to get clear after that. So it is better to attend to that whenever you see a problem. The conventional treatment typically involves antibiotics, but in homeopathy we refer the complementary approach to manage the UTIs. So whatever likely symptoms are being addressed and we will manage the infections. Both sexes are affected by urinary tract infections, but women are more prone to get this infection due to their physiological condition. The body make up this what is making them prone to the problem. The urethra is very short for them. It opens very close to the anus and makes it very easy for bacterial infection and bacterial contamination. So the gut bacteria, Escherichia coli, E. coli, which is inside the gut, can easily get access to the urethra for the babies because it is very close to the anus. It opens very close to the anus and also it is very short in length, while male urethra are very long and it is actually spaced very far off from the anus. So males are technically safe from urinary tract infection, provided they either get cross infection from the infected babies or the behavior is very bad, hygiene is very poor. So you can see the structure of the urinary tract urinary system. So you can see kidneys are well placed and all, and they have ureters which is connecting to the bladder, and bladder opens to the outside to the urethra. So this release is very short. The urethra is very short, while male ureters are long. That's what we are discussing. So what are the problems when you have urinary tract infection? You have back pains, and the reason is because the kidneys are badly affected by the bacteria. The bladder will be affected by the bacteria, and overall the tract will be infected by the bacteria, and the urine passes through the inflamed tissues. You get pain or burning sensation, whatever it is. So this is how pictures show. Now we see the cause of the urinary tract infection. Urinary tract infection occurs when bacteria or virus of fungus. So these are bacteria, virus of fungus. All of these microorganisms can cause this problem. Enter into the urinary tract. So either of these, one or many, enters into the urinary tract through the intestine and multiply in the bladder. These are ureters causing urinary tract infection. So it can be either virus or a bacterial infection or a fungal attack. And this can get infected, infected, the urinary tract can get infected, bladder can get infected. So this is the cause, technically, this is the cause. Any three of these microorganisms can create problems. Bacterial infection we just see. The most common bacteria that causes UTI is Escherichia coli, E. coli, and it is also called UPEC, that means uropathogenic Escherichia coli. So not all coli's, certain strains which are pathogenic in the urinary system, strains are their ability to go into the urinary system is the problematic one, that is called UPEC. Then is uropathogenic Escherichia coli, which is normally found in the colon. So inside that we have this all type of Escherichia coli, and this also is there, and this is practically the problematic bacteria. Other bacteria that causes UTI includes Enterococcus bacteria, Klebsiella bacteria, then Pseudomonas and Staphylococcus bacteria. So the different bacteria affects our system, and of these, E. coli is the most important one, and we have the Enterococcus, Klebsiella, then Pseudomonas and Staphylococcus also infect the urinary tract. Viruses like the herpes virus can affect the urinary tract, making urination difficult and painful. Other viral infection, viral UTIs can occur for persons who are immune system is impaired, immunocompromised persons dying cancer or AIDS or using medications to suppress the immune system. So all these people can also get infection, the urinary tract infected by viruses because their immune system is compromised. So that's the virus. Now fungus. The common fungus is Candida. This Candida can organize into the patients, the persons who are being treated at home for predominantly years and all. So residential care patients, diabetics, and those who are immunizing catheters. So some people who have urinary incontinence and all, and their urination is not under control, so they are under the catheters. There will be some tube inserted into the bladders, and that's called catheters. And there will be inside the non-new object is being put into the system for a long time. It can attract organ growth. So that is called because of inbuilt catheters or are immune compromised. So immune compromised people can also get infection from the fungus also. So fungus infection, Candida, is one of the causes. Now we see that urinary tract infection, the common causes and risk factors. One is how does it actually happen? Why do you get this urinary tract infection? How do you approach with that? So people who maintain poor hygiene, they have weakened immune system. Their hormonal changes happen because of menopause and all getting older and all hormone levels change. Those people can get chances of getting infection. Urinary tract abnormalities. Sometimes the urinary tract will not be proper. Blocks will be there. This will be there. Sometimes the bladder shapes can change and hold urine inside the system, and that can attract bacterial or fungal infections there. Prolonged catheter use. I spoke about catheter now. So there is a system where you put catheter tube inside the bladder and remove the urine that is stuck there. So that's called catheter usage, and they will also get these problems. Then sexually transmitted infections. So if the lady is having urinary tract infection, after sex a man can also get infections, and the other way also. So sexually transmitted infections, diabetes is another cause. Pregnancy, because of pregnancy, a lot of these fertilizations happen inside the system. The lady will be finding it much difficult to go around and do her normal duties. and that way even urine bladder is compressed and reshaped, and thereby she may be holding uncovered stale urine, and that may also be one of the cause of infection. Then another cause, we already said, what were the hormone issues, and because of that, the urine will be retained, and the tract can also have a lot of hormonal changes which will attract the microbes below there. So you know what? Then family history. The family has urinary tract infection history, and all were suffering from various other reasons or other kinds of infections. They may also get a chance to get infection in the urinary tract. We spoke about catheter. This is catheter, a plastic tube, a flexible tube inserted up to the bladder, and there is a knob which is inflated by injecting water through the other part of the catheter. There is two openings there, and the water is injected so that this knob will be inflated inside the bladder so that it will not fall down easily. It will be holding there, and this catheter will be open there, and the urine can drain out as and when we want them to be removed. So it will be automatically drained with the bags. So same way for the urine also, it will be passed through the penis and we insert it into the bladder, and the same technique of expanding the knob here to hold the from falling back into the urethra. The knob is inflated. So this male and the female portion of catheter insertion. The types of urinary tract infections we will discuss. There are different types of infections. One is called cystitis, that is the infection of the bladder. Cystitis is one of the urinary tract infections. Then is pyelonephritis. It is the infection of the kidneys. Urethritis, that is the infection of the urethra, and for males, prostatitis, that is the infection of prostate glands. So these are the versions of urinary tract infections which people can have. But now we will see the common symptoms, signs and symptoms of urinary tract infection. The common symptoms are urine sensation, void urinating, that is called dysuria. So when they pass urine, you will be going dysuria. Then frequent or urgent urination. So we have a frequent feeling of urinate, and we cannot do it, it will be urgent. So that is one type of the symptom. Next is cloudy, dark or strong, smelling urine. So the urine will not be clear, it can be dark and strong smelling. That is one of the symptoms. The blood in urine, hematuria. That is blood because the walls may get infected and inflamed and can lose out blood. So the urine will be red in color or light pink color. So that is blood in urine, it's called hematuria. In pelvic area of discomfort. So the pelvic area where the infection actually is going on inside, you will feel discomfort, and that is one of the symptoms. Then because of the infection, there will be fever, and the fever is specific because there will be constant chills, high fever, where you literally feel shivering. That is one of the symptoms. Then the abdominal cramps, because of the infections inside the abdominal organs, in the abdominal cramps, then flank pain, that is between the ribs and the hip, that area where you have, it's called flank, and the pain will be there. So these are the symptoms which will be expressed by the people who have urinary tract infections. Now, you can see the picturized form of that. There will be difficulty in passing urine, there will be high fever, there will be chills, then cloudy and bad smelling urine, then pain in the flank areas on the hips and the hip area that will be paining, and pain while passing the urine, and difficulty in sex, pain while after having sex. So fever again, the low back pain will be there on the side, then blood in the urine, and the urgency to rush to pass urine. So these are the pictures for to be remembered for the back pain, for the urinary tract infection. This area is called flank, and the pain here is called the flank pain. So everybody knows that it is, we call it back pain, but actually it is not the back pain. Back pain is somewhere in the center, and this is the flank pain. So now we will discuss symptoms specific to different types of urinary tract infections, and we spoke about various 4 types of infections. Now we will talk about cystitis. The cystitis will have painful urination. When you have bladder infection, you will have painful urination, frequent urination, urgent urination, and blood removal. So all these symptoms what we discussed for common urinary tract infection will be shown by a patient who has cystitis, that is urinary bladder infection. Next is pyelonephritis, that is kidney inflammation, kidney infection. Will have severe flank pain because the kidneys are located high above the backside, above the pelvis area. So when there is infection there, we get pain there. Severe flank pain, fever and chills will be there. Nausea and vomiting will be there, and urine will have blood. So this is called pyelonephritis, kidney is infected. Next is cystitis. We can see the bladder, which is cystitis. The urinary bladder itself, you can see it's all inflamed. That it will be the inside the bladder will be like the blood vessels will be all inflamed, and kidneys will be swollen, and the kidney, the bladder is very sensitive. The wall of the bladder will be swollen. Cystitis. So cystitis again, risk of cystitis, risk factors is female history of UTI, female sex and history of UTI, sexual activities, vaginal infection, diabetes, obesity and genetic susceptibility. These are the risk factors of cystitis. Clinical symptoms is frequent and nasal urination, dysuria and suprapubic pain, nocturnal, that is urination while the night, hematuria and malaise. So all these are the clinical symptoms. Then the positive organisms are inside uropathogenic E. coli, that is UPEC, Pneumoniae, pneumonia, Staphylococcus, Enterococcus, Physalis, and others. So these are the positive organisms. And the selective uropathogenic viral factors will be additions. That is type 1 and type 2, type 1 and type another which is some things are being given, and the toxins will be there, cyanopherols and some capsules. So these are the treatment methods and the resilience factor, so which is too complicated for us to understand. So we will go over the pyelonephritis, the risks such as diabetic people will have, AIDS and HIV people they have this factor of the people infections. Immunosuppressions will be there, congenital or acquired urodynamic abnormalities will be there. So these are the risk factors for people who have who can get kidney infections. The clinical symptoms will be back pain and flat pain, fever and chills will be there, malaise will be there, nausea and vomiting sensation, and anorexia will be there. These are the clinical symptoms. Causative organs again the same similar one, that is UPEC, that is uropathogenic Escherichia coli, then Cassidia, then Staphylococcus, Enterococcus, both these species and others. These are the different bacterial organisms, microbes, which are affecting the problem, and the same additions will be there, toxins will be there, then the same symptoms what we saw for the cystitis will also be felt by the patient. So we will go for that. So kidneys, you can see normal kidneys will have a smooth surface, whereas affected kidneys will have the scarring of the outer surface will be uneven and scarred, and all the insides will be clear, where the pyramids will be sharp, where he has the inflammations inside the kidneys will be seen. So kidney also will be unshaped when it is really badly infected. So now we will see about urethritis. Urethritis is the infection of the urethra. Burning sensation while urinating, discharge from urethra, and itching or irritation will be there. So urethra may discharge some unusual liquids, and this is because of the infection going on there. There will be burning sensation and itching and irritation will be there. Prostatitis will be painful urination, frequent urination, painful ejaculation, discharge from the urethra. So these are the prostatitis symptoms. So symptoms are, you can see uneasiness, discomfort, pain, constant urine, frequent urination, urgency. These are the common things for common infections. So now we spoke about specific symptoms also. Now we will see the complications of urinary tract infections. What are the problems? If you do not treat it, kidneys can get damaged. There will be sepsis there because of the infection. There will be septicemia. The blood can get infected. Like recurrent urinary tract infections will be there. It will be typical frequently getting infected. In chronic kidney disease, a kidney failure can happen because the kidney is getting infected and damaged. Then pregnancy complications also. these will all get into the infection can get inside to other organs also, and like ovaries and other things, and there will be complications in the pregnancy also. So, how do you diagnose the urinary tract infection? Diagnosis is urinary analysis. So, urine for test, urine culture. Urine for culture, you can see how it is, how many type of different organisms are going in there. Imaging test, that ultrasound and CT scan can show what is exactly wrong in that painful or discomfort area. Some infection is going on. The physical examination, you will see it is the area, the urinary tract or vaginal area where the patient is having problem will be not normal color, it will be inflamed and turgid color. So these are the diagnosis methods. So treatment is normal treatment by giving antibiotics because it is a bacterial infection normally, yesterday check all that. And the other thing is to manage the pain, take lot of water, food intake, urinary tract, emergency which is received for the urinary tract, and then lifestyle changes like hydration and hygiene. So keep on taking out of water and maintaining your personal hygiene is a normal treatment advices. Along with antibiotics and pain management things which are done by allopathics. You will see what we do. So this prevention for urinary tract infections is like this. Practice good hygiene. Use only clean and safe water and the towels. That is really, especially after you pass urine, you clean yourself, but unfortunately if the water is not good, there is a very good chance to get contamination from those things. So be very safe, practice good hygiene, personal hygiene, and use only clean water. Have sufficient water always and stay hydrated. So drink a lot of water and keep on flushing out whatever is encroaching into your tract by drinking a lot of water and crossing urine so that infections will not be found in the system. Next is always urinate after sex to flush out any infections in the organism or infectious organism in the tract. This is an important thing where when you are introduced into some organisms are introduced into your system after sex, then if you pass urine, that can be flushed out. The other thing is avoid tight clothing which promotes sweating in the private area. So always use cotton undergarments and avoid sweating in the private areas so that bacterial growth and the atmosphere for growing bacteria can be avoided by preventing sweating in there. Next is the pubic hair. Always avoid the pubic hair always to be avoided. That is, removing pubic hair always avoids de-infection. That means the hair follicles will be harboring these organisms. They are exposed, and if it is always there and sweating is also there, then the bacteria multiplies outside and then enters into the system. So removing pubic hair always avoids re-infection as hair shaft harbors bacterial spores. When managing stress by practicing mind relaxing techniques like meditation, yoga, etc. So now you will see when to seek medical attention. So when you have to go to the doctor to get this treated. The severe symptoms, if the symptoms are unbearable, pain is bad and all those things and all those urinary tract symptoms are there, that you will go and have a treatment and treatment started. That will be, he or she will have difficulty in urination, will be blood urine, fever which is maintained around 101 degree, 101.5 degree Fahrenheit, then will be vomiting, flank pain is a feeling discomfort and distress or agony in the side of the back, just below the ribcage and above the waist. It can be on one side or both sides. So this is the flank pain, which I explained properly in the picture also you have seen. So these symptoms are there. If these symptoms are there, it's better to go to the doctor to get yourself treated because untreated urinary tract infections can become dangerous. Kidneys can get bad, kidneys can get failed also. So now we will see how homeopathy can do some improvement of the urinary tract infections. Homeopathic approach as mentioned we discussed homeopathic approach and strategies. The acute treatment is there. Suddenly it happens. So focus on eliminating the immediate symptoms. So acute treatment is to immediately bring the problem symptoms under control. Next is constitutional treatment, constitutional treatment, which addresses the underlying susceptibility to nucleic. So that is a long-term and long-lasting solution. then preventive treatment is by boosting immune system to prevent the recurrence. So these are the approaches where homeopathic physicians will address the urinary tract infections. So homeopathic medicines for UTIs is acute UTI remedies are canthars will have severe body sensation, inflammation and bloody movement. So canthars can bring these symptoms under control by preventing the inflammation and preventing the burning sensation like that. Purpose vulgaris, everybody knows, is a very good urinary tract infection medicine. The pain in the kidneys is brought down. Bladder or uterus or urinary retention will be addressed by purpose vulgaris. Next is Apis mellifica. Stinging pain, swelling in the genital areas is addressed by Apis mellifica. Pulsatilla, the UTI in women, especially during the pregnancy or menopause. Pulsatilla is a very good medicine, women's medicine, and will help in controlling women having UTI. Then next is Saxaphila. Pain, severe pain in the kidney, severe pain and kidney problems. So these are taken care by Saxaphila. Now, chronic remedies, we will see chronic remedies with the disease is called chronic status syndrome or recurrent UTI, then chronic UTIs, then Naxomica, UTIs caused by holding urine. Certain people have their job responsibilities where they cannot pass urine frequently and they hold urine and then they get urinary infections. Well, for them, Naxomica is the best medicine. Dalteparin for UTIs with kidney problems. Sepia is for women, again UTI in women, especially during menopause. So Sepia works in that time for ladies also. The initial immune boosting remedies are echinacea. Echinacea enhances the immune system functions. Use of oxygen boosts the immune system and prevents infection. Hydrastis will support urinary tract health. Then Eva-OC is prevent bacterial growth, reduce the infections, risk of infections and all. So the next is verbal fertility we already spoke, supports kidney and urinary tract health. So these are the medicines which will be supporting the immune system, boosting the immune system. Now we will go for group specific, like men, lady and children. If you are pregnant is lady infected, what are the medicines which will work for them? Pulsatilla works for ladies. Prevent UTIs during menstruation and menopause. Sepia supports urinary tract health during menopause. Dalteparin prevents the UTI during pregnancy. Then if it's infected, say Haemophila ampelata is a good medicine, supports both prostate and urinary tract health. So that is prevents UTIs and supports prostate health. So we all know Sabazolita is used for prostate enlargement. So these both medicines are supported for prostate gland. So infections of prostatitis or men's urinary tract infection will be also handled by these two medicines. When children are infected, double boosts the immune system and prevents UTI. Then Pulsatilla prevents UTI in children. So these are the group specific, gender specific medicines. Now we will see remedies specific for symptoms. Now burning sensation, canthars and Apis mellifica works for burning sensation. Inflammation, Berberis and Pulsatilla. Blood and urine, canthars and Saxaphila. Kidney pain, Berberis and Dalteparin. Bladder pain, Apis mellifica and Theriaria. So these are the symptoms specific. Now we will see recommended potencies for all these things. Like we will go for wide and medium type potencies only, and that way it goes on the system and people very well. So CC, 30C and 200C is the way of selection of blood and these remedies, the potencies. So these are the medicines what we discussed. That's all for the time being, and we will see on another discussion shortly. So thank you so much, sir. You can continue, sir.
Sir, thank you, sir. Suresh Kumar.
Yes, sir.
Suresh, sir. Suresh, you can take.
It's audio is okay.
Yes, it is okay. Yeah. There is some background noise, but anyway, it is okay.
Good evening and a warm welcome to all the team members and we'll continue with the therapeutic indexes where we left last Sunday, and in that series, the next disease condition will take as a fissure. So, what is fissure? Fissure is a crack or is a split in the tissues that line our muscles or skin. And example is the anal fissure. It can be lip fissure. It can be also sole fissure also. So it's a crack or split on the skin, layer of the skin. So this condition is known as fissure. So what are the remedies, primary remedies indicated for fissure? Always we think of first graphitis, then nitric acid, silicea, lead, petroleum, and metanium. These are the metanium is very important from the point of view of anal fissure. So fissures, these are the 5 remedies which are very important. 6 remedies: graphitis, nitric acid, silicea, lead, petroleum, and metanium. Next, disease condition is fistula. Fistula is known as abnormal passage from an abscess or from a hollow organ to the surface or from an organ to the other organ. It is an abnormal passage from ulceration to the surface or ulceration to the other hollow organ, or from one hollow organ to the other hollow organ. So this communication is known as fistula. So what are the remedies for the fistula? For fistula we can always think of nitric acid, silicea, acid fluor, sulfur, calcareous fluor, and China. So these are some of the important primary remedies we can always think of for fistula: nitric acid, silicea, then fluoric acid, then sulfur, calcareous fluor, and China also. And then coming to next is flatulence. So for flatulence, we know many remedies, but just to repeat it or again remind you again, flatulence, the primary remedy is carbohydrates, of course lycopodium, then China. These are the primary remedies, but followed with it is Nux vomica, Asafoetida, and arsenic album also. So these are the first line of defense of this for flatulence: carbohydrate, lyco, China, Nux vomica, Asafoetida, and arsenic album also. Then moving on to the next alphabet, G, gallstones. Disease condition is gallstones. So what are the primary remedies for the gallstone? So for gallstones, definitely we have first to go always with the what's called Barbaris vulgaris, and then we can think of China, then Chionanthus, Chelidonium, and calcareous carb, and also Colestrinum also. So these are some of the primary remedies for gallstone. I repeat: China, Barbaris vulgaris, calcareous carb, Chionanthus, and Chelidonium, and Colestrinum. So these are some of the primary remedies for the gallstone issue. Then coming to next important stage is gangrene. What is gangrene? Gangrene normally happens in case of diabetic conditions, diabetic feet, is state of diabetic feet. It's the death of the body tissue due to the lack of flow of the blood to a particular portion, and it is followed with subsequently infection with the bacterial condition, bacterial infection occurs in it, and later on, after bacterial infection, the putrefaction starts away, and ultimately it leads to necrosis, that is called as death of tissues. So this is the phenomena of a gangrene. So where on account of the loss of blood to the particular segment or portion of the leg, followed by bacterial infection, putrefaction and necrosis, that leads to death of the tissues, death of the cells. So this is the gangrene formation. For gangrene, we can think of cereal cornatum, arsenic album, lachesis, carbovec, crotalus, and we can also think for gangrene hydrocodone also, because one of the gangrene cases which I had opportunity to deal with, where there I used hydrocodone also, and it has a good result also. So some of the priorities I repeat for gangrene condition, cereal cornatum. No doubt arsenic album is a great remedy in this condition. Lachesis is also great remedy, and carbovec, crotalus horridus, and lastly hydrocodone also. So these are some of the prime remedies for the gangrenous situation or gangrenous conditions. Then coming to next disease condition known as gastralgia. Gastralgia is known as pain in the stomach or epigastric pain, especially it is of neuralgic origin. So gastralgia is basically because of the neuralgic origin. So what are the remedies for the gastralgia? So Nux vomica, arsenic album, metphos, chamomilla, then carbovec and phosphorus. These are some of the prime remedies which can be called for the given condition of gastralgia. Nux vomica, arsenic album, metphos, chamomilla, carbovec and phosphorus. So these are the prime remedies for the gastralgia. Then the next in the series is gastric ulcers. What is gastric ulcer? It is also called stomach ulcer. It is also known as peptic ulcer that occurs in the stomach as occurs in the stomach acid, formation of stomach, excess stomach acid in the form of HCl, hydrochloric acid, and that excess secretion of the hydrochloric acid destroys the lining of the digestive tract, and the most common cause for the peptic ulcer is due to bacteria known as H. pylori. So it is basically a lesion on account of the excess secretion of the stomach acid, that is hydrochloric acid, and that destructs the digestive tract, and subsequently the bacterial infection occurs, and the most common phenomena is infection due to H. pylori. So for this gastric ulcer, what are the important priorities? For gastric ulcer, we can think of arsenic album, then argentum nitricum, then chalypite, uranium nitricum, and very rare remedy recommended for this is also here. It is known as atropinum. Atropinum is also called for gastric ulcer. So we can think of as a first line of defense remedies as arsenic album, argentum nitricum, chalypite, uranium nitricum, and atropinum. So this is some of the prime remedies we can think for gastric ulcers. Then next disease is called gastritis. There is a difference between these terms, so I am specifically giving all this explanation to these terms also. So gastritis is is a group of conditions. It's called like a syndrome. So it's a group of conditions in which the stomach lining of the GI tract or stomach is inflamed, associated with epigastric pain, burning, and there's a nausea, also sometimes followed with vomiting also. So it's a group condition. So in this gastritis, on account of the inflammation of the stomach lining, it causes epigastric pain, it causes inflammation and burning, it also leads to nausea as also vomiting also. So this is the condition of the gastritis. So in gastritis, what are the prime remedies indicated here? In gastritis, again, we always think of arsenic album, then phosphorus, nux vomica, pulsatilla, then myrrh, salt, then phosphorus, and also oxalic acids also very rarely used in our clinical condition, but it is also can be thought of if needed. So for gastritis, we can think arsenic album, phosphorus, nux vomica, pulsatilla, myrrh salt, and also oxalic acid, and the let's not forget myrcor also. So for gastric condition, myrcor also can be thought of. Basically, it's for all ulcerative conditions, we can think of myrrh family. Myrrh family has got ulcerative all conditions there, so we can think both myrrh salt and myrcor also in gastritis also. So these are some of the prime remedies for gastritis. Then coming to next is glandular affections. So for glandular affections, it includes the inflammation of our salivary glands, and then lymphatic glands, then sebaceous glands, thyroid glands, also mammary glands. So glandular affections, any type of infection can happen in the salivary glands, lymphatic glands, sebaceous glands, thyroid glands, also in women in mammary glands also. So what are the important prime remedy for glandular affections? For glandular affection, we can always think of first as iodine. First medicine goes in the mind, iodine. But with that, our best friend is belladonna. We can think of belladonna, iodine, spongia, phytolacca, sulfur, then calcareaflor, as well as calimure also, calimuriatinum also. So we can take this kind of remedies, these types of remedies as a first line in our clinical condition. I repeat, for glandular affection, iodine, belladonna, spongia, phytolacca, sulfur, calcareaflor, and calimuriatinum. That next is series is bleach. In what is bleach? It is a watery discharge with pus and mucus on account of the inflammation of the urethra, and it happens on account of the gonorrheal infection. Whenever there is a gonorrheal infection of the urethra, then such type of symptom emanates, and it results into drainage of or discharge of the watery discharge with pus and mucus. So this is known as bleach. And for bleach, what are the remedies indicated? It is sulfur, sepia, thuja, natrum muriaticum, pulsatilla, and also nux vomica. Let's not forget nux vomica is also one of the good remedy for bleach also. So for bleach, we can think again, I repeat, remedies: sulfur, sepia, thuja, natrum muriaticum, Persevera, and nuts vomica. The next very commonly occurring condition is glossitis. So we come very frequently in clinic. Glossitis. Glossitis is a condition of the tongue, and the tongue becomes inflamed. Tongues gets red, fiery red, and swollen also, and tongues may be smooth and glossy also. So glossitis is inflammation of tongue with swollen condition, and it may look smooth and also glossy condition also. So for glossitis, what are the remedies? Important remedies is lachesis, mud salt, APS, muriatic acid, rustox, and phosphorus. So these are some of the important prime remedies we can think of glossitis also. So lachesis, mud salt, APS man, muriatic acid, rustox, and phosphorus. So we can think of these remedies in case of glossitis. Then next condition is gonorrhea. Gonorrhea is a sexually transmitted disease, and is a sexually transmitted bacterial infection caused by bacteria, viruses, and also parasites. It can infect the urethra, it can infect the rectum, it can infect the female reproductive tract, it can affect the mouth, throat, also eyes also. So it widely affects different organs, the gonorrhea. It's a sexually transmitted disease, I repeat, on account of the bacteria, virus, and parasites, and basically first affects the urethra. It can also affect the rectum, female reproductive organs, as well as mouth, eyes, and throat also. So for gonorrhea, different remedies you can think of: gelsemium, nitric acid, petroleum, sepia, medeonium, and cannabis sativa also. So medeonium is a very prime remedy, and other than this, we have gelsemium, nitric acid, petroleum, and sepia, medeonium, and cannabis sativa also. So these are some of the important remedies for gonorrheal situation also. So then goiter, next disease condition. Goiter is inflammation of the thyroid gland, and commonly is linked to iodine deficiency. So on account of iodine deficiency leading to thyroid gland inflammation. So this is known as goiter, and the rest mentioned is iodine, spongia, calcium, natrium muriaticum, and mud salt. So these are the five prime remedies for the goiter: iodine, spongia, calcium, natrium, and mud salt. And last for the today will solve this. The disease condition is gout, and gout is very common in our clinical conditions. It's a complex form of arthritis, and which is characterized by, which is exhibited by severe pain, redness, tenderness, swelling, tenderness of the one or more joints. So these are the symptoms of the gout, and it is due to the formation of the uric acid crystals in and around the joints. So on account of the formation of uric acid crystals in and around the joints, this type of inflammation occurs, and this condition is known as gout and gouty conditions. So it's a complex form of arthritis. So for gout, we have got the breast medicine colchicum, to start with, we have got another blue excellent medicine, ledum, and then we have got lycopodium also. We have got lithium carb also, and we have got very good remedy Artica urens also. Artica urens also for the gouty situation. But the priorities normally we use colchicum, lithium carb and ledum, and apart from that lycopodium can be thought of as a constitutional remedy, and Artica urens is another important remedy in treating the gouty conditions. So with this, I give pause to my talk today, and we will continue with some more disease conditions in the next classes. Over to Dr. Murthy.
Is my voice audible?
Yes, sir.
Yes, sir.
Namaste, my dear homeopaths. Thank you very much, Surendra sir, Anup Kumar sir, and Suresh.
One thing I want to add to the urinary infection, tract infection.
Sir.
Adult 29.
Okay, sir.
Very good, sir.
It's a combination.
It's a combination. It's a combination German medicine. Adult combination.
It contains, 1 minute, it contains acidicum benzoicum, acidicum nitricum, clematis, liquistum, Papus, Pulsatilla, Zodiaco, and gingival. Coming to that, I will tell you, but if you take single remedies, according to symptom you go. But in this combination, no such medicine is found where Berberis vulgaris, Liquistum, Cantaris is indicated. That's not there. That is how the homeopathy is changing this German medicine, and it is very, very effective. Why? Because when urinary tract infection takes place, if you don't attend it within a day or two, you get fever and complicated things. That is why this medicine, you all keep it, adult 29, German medicine.
Sir, you shown
One
this.
or 2 days that comes out, everything is done. Okay, thank you, and what the more.
So we will merge 2 points here. As per Surendra sir, urinary tract infection, one medicine he has told about Adel company, that is a foreign medicine, very best combination available in that. Suppose if you want to treat a chronic urinary tract infection patient means, you have to select Berberis vulgaris, acid bends, and whatever that is the other medicine, Cantaris or like that you can select. Along with that, you can give this Adel number that will work within 10 days. The chronicness will be reduced and you will feel better. And here one more thing, we will combine the Surendra sir lecture and Suresh Kumar lecture. Suresh Kumar has told in the last gout. It is in the process of urinary tract infection, kidney failures and lower extremities imbalances. At that time gout will come in a aromatic manner. At that time there also you are having urticarians, acid bends, nitric acid. These 3 medicines will work excellently. Along with that, don't forget colchicum. Colchicum and ledampal are the most important. They are just like a twin remedies for gout. You should not forget. And if possible, if the symptoms are asking, lithium carb also one of the best remedy for that. So we are having these type of combined symptoms. You can give colchicum, ledampal, urticarians. If possible, try lithium carb also. And don't forget foreign medicine, either Rigway or Adel company, these two very excellently popular nowadays. And one thing that their combinations are very successfully palliation. Palliation is there. And one more thing, George sir, I am telling, Saint George Medical Company is there in Kerala. They are also manufacturing so many rare drugs. If possible, you take their shop or anything, whatever the literature available with them, that you study. It will be very, very useful for you. Saint George Homeopathic, some company or laboratory, something is like that, but very rare medicines they are bringing, and all mother tinctures also they are bringing, and all potencies they are bringing, very, very rare medicines. And it is not available everywhere. It is not available everywhere. Only selected areas it will be available. Previously, Father Muller is also having excellent remedies. Those remedies will not be available on medical shops. Like that, nowadays Saint George has brought so many medicines. That also you, because why I am telling George, you can remember that one. It is in Kerala. It is very popular. Since you are very much interested, I am telling that one. Any doubts? Your time is over.
So one more thing, sir. First question, sir. Sir, in my clinical experience, I have given Canadian Q for the ladies for the UTI. That works well, sir.
Very, sir. Very.
Okay, sir. Thank you very much. We will meet next week. Sir, Anup Kumar sir, thank you very much.
Okay, sir. Thank you.
I wish I have all the elect members the happy Deepavali.
Happy Diwali to all.
Happy Diwali. Happy Diwali, sir. Happy Diwali.
Happy and very entertaining Deepavali.
Happy Diwali and everything.